Nightmare disorder can be defined by the persistent reoccurrence of nightmares. These nightmares can be well remembered when patients wake up and impair them throughout their day. They can leave them afraid to go back to sleep because they do not want to have another nightmare or continue the nightmare that they were having the night before. Sleep deprivation can be caused by the effects of nightmare disorder and can further impair patients who suffer from nightmare disorder. The stress that arises from the effects of nightmare disorder can be devastating. The DSM-5 of nightmare disorder include the recurrent episode of extended, extremely dysphoric, and well-remembered dreams that usually involve efforts to avoid threats to survival or security or physical integrity. The nightmares generally occur in the second half of a major sleep episode. Upon waking from the nightmare, the individual rapidly becomes oriented and alert. The episodes cause significant distress or impairment in social, occupational, or other areas of functioning. The symptoms cannot be explained by the effects of drug abuse or medication, and these nightmares cannot be attributed to another mental disorder. The true prevalence of nightmare disorder has been difficult to determine, but current data has shown nightmare disorder to be more prominent with women. However, women tend to decrease in nightmares as they age, while men, on the other hand, experience the opposite and increase the reoccurrence of nightmares with age. These kinds of nightmares has also been reported frequently in children under the age of 18 and also in patients who have been diagnosed with other psychiatric disorders. One psychiatric disorder that is prevalent to experience symptoms of nightmare disorder is post-traumatic stress disorder. Patients who suffer from post-traumatic stress disorder may experience the reoccurrence of nightmares that force the patient to relive their real-life trauma. These patients may experience multiple nightmares in a week's time. They may also experience trouble falling back asleep and wake up multiple times during the night. Idiopathic nightmares, on the other hand, can start from childhood and are not caused from trauma. If you are suffering from reoccurring nightmares and feel like other parts of your health and your life are also suffering because of them, there is help available to you. Therapy by means of imagery rehearsal therapy and cognitive behavioral therapy are some options that you can speak to your mental health professional about. Call your local trusted behavioral health clinic or talk to your primary care physician who may be able to recommend a mental health professional to you. Remember that mental health is just as important as physical health, and they go hand in hand.